So 13-year-old Savant on a bright Monday morning, sitting in my clinic in front of me, is a young tennis player. And he complains that I've been having this pain in my forearm and my elbow over the past 6 months. Initially, the pain was there only after I played for long hours. I would feel some soreness. And now I have reached that point where, because of the pain, I'm not able to play anymore. I examine him, I see him, I find his forearm is tender. There is a lot of pain over this region where the muscles, extensor muscles, arise from here. And I clinically suspect him to have a tennis elbow. You all must be familiar with this term because some very famous sports person had this issues. So I suspect him to have this. I do an ultrasound. I confirm that there is tears of the muscle, and I tell him that you are going to be off sports for next 3 months, and this is going to be a treatment plan. More than the kid, I see the parents are more anxious because of what I have just said, that you're going to be off sports for 3 months. They say he has a very important tournament coming up in 1 month. He has to play in that at any cost, right? So this on date is a very, very common problem where young kids who are supposed to become sports prodigy in future, they have a lot of pressure put by themselves, by their family, by their friends, upon themselves, by their coaches, everyone. And they undergo these early career injuries, which sometimes they are not able to come back from because of a lot of factors, and it's the end of their careers, or the careers which they could have become, they are not able to become because of their injuries and not the proper management of their injuries. Case number 2, just after this patient, next patient comes in. 33-year-old Savitri, a homemaker, doesn't play any sports. Similar complaints, pain over in forearm, same thing. Last 5 months, I would only feel some soreness over here at night when I used to go to sleep before that. And now it reached a point where I can't make the dough, I can't broom the house, I can't wash the clothes with my hands, I can't even milk the cow. It has reached that point. And again, I suspect it to be tennis elbow. And the lady's husband was a well-educated man. And the moment I say tennis elbow, he jumps out of his seat. He's like, how can she have tennis elbow? She does not even play tennis. She has not played any sports, right? So this is something I see a lot in my practice. The so-called sports injuries, the prevalence of them is overall much more common in homemakers in Indian conditions, because a lot of these sports injuries are overuse injuries. Out of all 6 to 11 year age group of patients, 12% approximately, this is a data which I've shared from few studies, approximately 12% of all children of this age group will undergo sports injuries which will hamper their sports career in some way, sometimes minor, sometimes major, sometimes it's the end. Approximately 33% of all injuries in children are due to sports, some form of sports that they play. On one hand, a 13-year-old Savant is having tennis elbow. On the other hand, a 33-year-old Savitri is having tennis elbow. So what is going on? So most of the sports injuries are overuse injuries. Overuse injuries as in you do the same task repeatedly, every day, sometimes in the morning. So Savitri was brooming the house, she was washing the clothes with her hands, she was making the dough, she was milking the cow, sometimes two times a day, so, and 7 days a week, 365 days a year. So she was using it much more than Savant also, her the muscles of the forearm. So every time we do some activity for a prolonged period of time, our body undergoes injury, and then we give it some rest, our body recovers itself. We sleep, our body heals itself, everything is okay. And then we do the same thing again. Now, look at Savant. He was playing tennis, playing forehands 2,000 times in a day, practicing twice in a day, no week off. So both Savitri and Savant have the same issue, overuse of the muscles of forearm, leading to tennis elbow. What is sports injury is defined as? Sports injury is defined as injury or damage to the tissue which either leads to pain or disability. Early on, it is just pain, and later on, as the injury becomes more and more, it turns into disability. Disability is when even if you want with the pain, you are unable to do that function. So that is the definition of sports injury. It is either acute as in you did not have any symptoms until you got injured, you had injury, you had no symptoms before that. Or most of the times it is a overuse injury. That is, you are repeatedly using the structure again and again without giving it the time to heal itself. Now, uh, on today's day and age, why are we seeing more and more sports injuries in young people is because few years back or in when I was growing up, we used to play sports for leisure, and we used to play five sports or four sports or different sports, right? But with the sports evolving and the future of sports evolving as good career options, we are seeing more and more young children playing only one sports every day, 365 days a year. And when you play the same sports again and again, you are you are using the same group of muscles, you are using the same tendon, same structure over and over again. So it is essential to play different kind of sports and not just one sport. Symptoms, most important is you have to understand pain. What is pain? Pain is your friend. Pain is your best friend. When you're a sports person, pain is your best friend. It is not a problem. Pain is the strongest defense mechanism of body, which gives a signal to your brain that there is something wrong. It releases a chemical which is perceived by your brain, and it tells you there is something wrong. Please take care of this. Don't use it anymore till the time your pain goes away. Your pain goes away, that means your injury has healed. So pain, always listen to pain. The term load management is critical to understand. Uh, Both Savitri and both Savant need to understand this term, and they need to know that this is what we need to do. So Savitri does not have to wash clothes with her hands 7 days in a week. She can switch to washing machine. She does not have to milk the cow both times in a day. Someone else in the house can help her do that. Uh, Sawan does not have to play forehand 7 days in a week. One day he can do other practice. He can play alternate sports one day in a week, and one day no sports. Just give the body the time to recover. So load management is critical. Using different group of muscles, different activities is also very critical, both in a housewife and in a case of an elite sports person. Nutrition nests are critical. I will not go too much in details of that. Now, most important is early diagnosis and a right treatment. When you have had an injury, you have had pain. The pain is there for over a week. It's been 2 weeks, 3 weeks. Your pain is not going away. Now, the most critical thing is to decide what what is the cause of your pain. Why are you having that pain in that particular area? And once you decide what is the cause of your pain, the treatment is very easy. It is either rest, physiotherapy, medication, intervention, or surgery. So all you need to decide and know is what is the cause of your pain, and the treatment is very easy. So early diagnosis. So the reason you see a sports person who are playing at the district level, you will see most of them will say, I played till the age of 27 and I got into business with my father, or I started this job, or I did this. But people who go to the elite level, they say, I played till 29 or 39, 38, and then I moved on to, after the end of my career, to do something else. The main reason in those 10 years of longevity of the career of that sports person is the level of elite sports injury management and everything associated with it. That is the main difference in those 10 years between an elite sports person and a sports person who could have become elite with the right set of management of his injuries and his conditions. Now, this is the most important slide, and I can say officially that icing has probably finished careers of millions of sports person and athletes all over the world. It is a highly overused uh, form of treatment modality, and almost every injury is being treated by icing by everyone associated with sport, coaches, everyone. Uh, Only very rarely icing is good, only when it's only when it's a fat injury or a skin injury. Every other injury, tendon, ligament, muscle, every other injury, icing is not good because icing is antagonistic to healing. If your body is causing swelling in a particular region, it is causing because it is sending blood. The increased blood will cause healing. Icing is decreasing that blood flow to that region, which is ultimately going to decrease the healing. So icing is a big no. So the treatment protocols have evolved massively in the last 40 years or so. Until 1998, RICE, most of you must have heard this term RICE, rest, ice, compression, elevation. Until 1998, pretty much every management of sports injury was RICE, right? It was only in 2019 when it was realized that we need to remove ice from the management. And that's when they removed ice from the management of sports injuries. Now the current protocol is peace and love, in which is clearly and categorically mentions that no icing and no anti-inflammatory when you are doing treatment for acute sports injuries. Chronic sports injuries are different altogether. I don't want to go into treatment. This is just to give you idea the prevalence of sports injuries and how it thrives in sports person and how it works. Now, little bit about myself, how I've contributed to this field, and my journey in this field so far. So, I am a musculoskeletal and interventional sports radiologist. Most of you here must have heard this term for the first time. So, I'm a radiologist of only bones, joints, and sports injuries, and I super specialized within this field of radiology. Now, I finished my MD in 2014, and even during my MD, I had got some exposure to this particular field by chance, and I developed a lot of interest. And once I finished MD, I worked in a big public hospital in Delhi. In that hospital, during the 3 years that I worked there, I was the only one who was doing this kind of work. So, as a result, I got more and more and more and more exposure of this field, people with pain, people with sports injury. So the existing truth when I was getting into practice, the existing truth in our country at that point of time was that as a radiologist, you have to do everything. You have to do general radiology, you have to do abdomen, you have to do brain, you have to do everything if you want to make a good living. That was the existing truth when I entered into practice. But I was very clear, very clear when I was learning all this that this is the only thing I want to practice when I enter into my full complete practice. One day, this is the only thing that I want to do. And almost everyone told me that this is not possible. This is, you will have to pick at least two, if not three or four subspecialties. You will not be able to survive. Survive means you will not be able to make enough money to support your family and yourself. That is what I was told by everyone, including my own parents. They are also doctors. So I refuse to believe that, and I believe that I can make it work. Like I was one of the first few people in the country who started practicing this science of sports radiology and musculoskeletal radiology as an exclusive specialty and the only work that they do. And 2021, I founded this institute along with my partner, Jaipur Institute of Pain and Sports Injuries, where it is a exclusive institute for sports injuries and diagnosis and treatment of musculoskeletal conditions and musculoskeletal issues. So my message here is, what is the definition of truth? No one knows the definition of truth, right? So you have to believe in what you believe in, and even if there is no prior evidence till that date that this has been possible, right? If you believe in what you do, you will make it possible. You will find ways to make it possible. If there is no written path, there is no proven path on how you will make it happen, you will find ways. But that will only and only happen if you have a very immense belief in what you do. And the belief will come with skills, with hard work, with everything. So only belief is not going to do anything. It is going to be belief plus skills plus knowledge plus hard work plus patience, persistence, and everything. And as my previous speaker talked about ethical and ethics, so in medical practice, in one simple line, ethics is treat the patient as you would like to be treated. So if I was the patient and if this was some other doctor, how would I like this doctor to treat me? Treat your every patient that way. So no one has to make a phone call that please attend to this patient very well, he's known to me. You should treat every patient the same way, the way you would treat a VVIP so called or anyone else. So my message here is the truth is ever evolving. What is true today may not be true tomorrow, right? And what is true tomorrow may not be truth, the true day after tomorrow. It will keep evolving. It will keep changing. So as long as you are true to yourself, uh, you will always know when you are true to yourself. And so as long as you're true to yourself, your intentions right, you're doing the hard work, doing everything will work out in the end, just as you thought and just as you wanted, maybe even better. Thank you.